Time is brain, and so the quicker people can recognize a stroke, the quicker they can get their loved one to the hospital, the quicker people like me are there to help.
So in 2018, the national guidelines for stroke treatment expanded based off of new data that was obtained showing that treatment for stroke can actually expand past 16 and then even up to 24 hours after the onset of symptoms. So as we know, time is brain, and coming to the hospital as soon after symptoms start is very important still, but this allows a larger number of patients to be treated, because even if you have symptoms for 8, 12, 16, 24 hours, we still have a lot of treatments available.
The way people can remember the symptoms of a stroke, where they can tell if somebody's having a stroke, is to remember the words "be fast." So B stands for balance or problems with walking. That's a very common symptom of a stroke. E is for eyes, trouble seeing, double vision. F is for facial droop. A is for arm weakness. S stands for slurred speech. And T is time to call 911. So everyone in our community should really remember the words "be fast" when trying to resolve or trying to figure out if somebody next to them is having a stroke. Time is brain, and so the quicker people can recognize a stroke, the quicker they can get their loved one to the hospital.
Thrombectomy is the idea of removing a clot. We specialize in removing the clot from the brain, similar to what cardiologists do to the heart. So it's a catheterization. We go either from the wrist or the leg. We put a small catheter up under X-ray guidance and remove the clot from the brain, so that portion of the brain has blood supply again, and to prevent the stroke from getting worse and sometimes completely reverse it. It's one of the life-saving procedures that can actually bring back someone to life and prevent a stroke from progressing and prevent a hemorrhage, and more importantly, to bring back someone's ability to speak, to listen, and to move again. It's actually miraculous. Time is key, brain physiology is key, and having a multidisciplinary team of fantastic ER doctors like we have in Montefiore, world-class stroke neurologists, and an endovascular team of neurosurgeons and neuroradiologists that work really closely together.
While time is the most important thing when spotting the symptoms, the effects of a stroke don't have to be lifelong. The quicker people come to the hospital, the less likely that those deficits will affect them long term.